Welcome. I'm Tom Haderle, AHA Senior Writer, and today I'm speaking with Lindsey Burghstahler, Vice President of Programming and Intelligence for the AHA Center for Health Innovation. Launched this fall, the center seeks to guide hospitals and health systems in these transformative times. The center will better equip AHA members to disrupt healthcare, proactively manage change, make more data-driven decisions, and improve patient care and health in the communities they serve. It will provide forward-looking market intelligence, novel partnerships within and outside of the healthcare field, unique leadership development opportunities, and enhanced capabilities to spread leading practices at scale. Hi, Lindsey. Thanks for joining us.
Hi, Tom. Thanks for having me.
Now, Lindsey, as part of its work around market intelligence, the Center just released the first in a series of market intelligence tools. Tell me a little bit about these tools.
These tools focus on market disruption. We're profiling the major players, covering the moves they've made this year, and then touching on the potential impacts for hospitals and health systems. We have 4 tools that we'll be releasing. The first is a framework for making sense of the disruption that's going on. We also have an interactive timeline that summarizes in one place all of the things that have gone on over the course of the year, from new market entrants and vertical integration. We have a report on the potential impacts for hospitals and health systems and some thoughts by impact by type of organization. And then 20 questions for healthcare leaders to ask of themselves or with their leadership teams as they assess their organization's readiness and potential impact on their strategy.
What was the driver behind these particular tools?
There has been a great deal of activity in the healthcare space this year, and really new types of activity that we haven't seen before. So earlier in the year, we were tracking activity by new market entrants. So these are companies Google, Amazon, Apple, but new market entrants to the healthcare space. Through a series of announcements made really in the first quarter of the year, we started to see how they're thinking about their business in healthcare. And there were a couple announcements, one by Apple on starting employee wellness clinics. And then, of course, we're all aware of the Amazon, JP Morgan, Berkshire Hathaway partnership, again, to look at employee health. But we're tracking it so closely because we know that our members are interested in what comes next after they figure out employee health. So later in the year, we turned our focus on tracking vertical integration. That was when CVS announced that it would be looking to acquire Aetna. That deal closed just a few weeks ago. There was also buzz a while back that Walmart might be looking at a deal with Humana. Nothing has happened on that yet. And in fact, just a few weeks ago, there were announcements that Humana and Walgreens are in talks. So we'll see where that all shakes out. Humana also did some interesting things in the home health and hospice space. They brought in with 2 private equity companies as partners, and they did a deal to acquire some organizations that will help them expand their footprint in that care delivery, but in a different part of the healthcare continuum.
Can you explain the distinction between vertical integrators and horizontal integration a bit more?
Horizontal integration is the type of integration we're used to seeing in the healthcare space. Payers acquiring payers, hospitals and health systems coming together with other hospitals and health systems. Vertical integration typically refers to 2 companies in the same supply chain coming together. Here, though, we're talking about the supply chain very broadly because when we talk about supply chain, we have the delivery of direct patient care, but also the delivery of medications and all of the financing and payment that goes around that delivery. So you have retail pharmacies now, which we have in the CVS Aetna deal, partnering with payers in part because they've already experienced disruption of their retail business by companies like Amazon, and they're starting to fear disruption of their core business, that pharmacy business. And the payers that they're looking to partner with have really spent the last 18 to 24 months trying to expand their footprint in the care delivery space so that they can provide healthcare delivery more directly. What's interesting, though, is that when we tried to make sense of this disruption, we identified 6 key archetypes of disruptors. So yes, Amazon is a disruptor, but devoted health and pair therapeutics are also disruptors we're tracking. So these aren't necessarily household names, but they're capitalizing on market forces in healthcare and trying to do things differently. So they're not so different from Amazon's, but they're capitalizing on these different forces. And this is where we believe the framework will be helpful for our members in understanding the environment.
One of the tools looks at 12 characteristics of healthcare disruptors. Can you share more?
In our work on trying to understand disruption, we really sought to explore, is there something about these disruptors that's so unique? Why are they able to do the things the way they're able to do? And besides the obvious of really putting the customer at the center of everything we do, we're able to identify 12 cultural characteristics, organizational things that they were able to do that made them unique. But what's really exciting about what we found is that there's really no secret sauce to this. What they are doing, any hospital and health system can be able to recreate in their organization. So yes, it's going to be more challenging for them because they have long histories and culture is always hard to change. But for organizations that want to be nimble, that want to be more proactive, these cultural characteristics are all achievable. I'm not going to give any of them away here. You're going to have to go to aha.org/center and check out the report.
Well, Lindsey, what can we look for in 2019 from the Center's Market Intelligence arm?
We are planning, as you mentioned, a series of tools and resources on priority topics that align with the center's work. And the first of those topics for 2019 will be telehealth. So we're looking at AHA data on utilization of telehealth to show trends across the country, while also really trying to gather and share leading practices we're seeing within individual organizations we think that can be translated in other organizations. I'm also personally really excited about diving into the world of artificial intelligence, or AI. Of course, it's a really huge space, but in particular at the center, we want to explore the impact of AI on clinical decision-making and also on the healthcare workforce of the future. So if you look 5 or even 20 years out, we think the workforce will be very different because of the impacts of AI. And here's the exciting thing, Tom. We'll be releasing a new set of tools every couple of months.
Thank you, Lindsey. For more on the Center, please visit www.aha.org/center. And thank you for listening today.